Good afternoon. I'm Amanda Flynn. I am the administrative assistant within the MDH program. I work to provide support and guidance to our online students. I am excited to introduce our speakers for today's info session. First, Dr. Kara Werstein, Teaching Professor, Kinesiology and Health, Master of Digital Health Program Director of Education. She specializes in health, wellness, and behavior change courses. In addition to teaching, her professional mission is to translate research into practical solutions, which she achieves through various roles, including serving as a faculty member and as a clinical health coach and consultant. We will also have Dr. Kristen Metcalf, Assistant Teaching Professor of Kinesiology for the Master of Digital Health program in the Department of Kinesiology and Health at Iowa State University. Her expertise spans health and wellness, physical activity measurement, and wearable technology. We also have Dr. Michelle Rusch, Assistant Teaching Professor of Kinesiology for the Master of Digital Health program in the Department of Kinesiology and Health at Iowa State University. She has an extensive background in using simulation in healthcare, developing mixed reality applications to offset the effects of fatigue and cognitive and visual impairments. This will be a quick informational info session on the Master of Digital Health program at Iowa State University. We've left plenty of time for questions at the end and encourage you to submit questions as they come to you using the chat feature. First, we will give an overview of the program with quick information about the curriculum. We will discuss career opportunities in digital health, the online learning experience, and the student support and services available to online students at Iowa State. Now let's get into it. Kira, can you start by giving us an overview of the Digital Health Master's degree?
Yes, thanks, Amanda. This program teaches students to use digital health tools and data analytics to improve human health outcomes. We use information and communication technologies, and it helps to prepare students to manage health behaviors, illnesses, and health risks. The learning objectives for this program include integrating digital technologies, analyzing data, and incorporating innovative technologies. It combines understanding digital health technologies with the expertise in human movement, in health behavior, and health promotion. In the program, students will have hands-on experience learning these digital health tools and with data analytics, and they'll have opportunities to work with real-world digital health projects. Now, I will pass it to Kristen to share more about the program's curriculum.
Thanks, Kira. So we've taken a holistic approach to the curriculum, blending technological innovation with the health sciences for advanced digital health interventions. Our program is designed for working professionals, so it offers a flexible online learning format. The program involves 30 credits, and the breakdown includes 4 credits of foundational courses and then 24 credits or 8 specialized courses that include topics such as data analytics, AI, personalized medicine, telemedicine, public health, and more. So 2 credits are then dedicated to the capstone project. The 2 foundational courses are Foundations of Digital Health and Research Methods and Ethics of Health Technologies. The Foundations course explores the intersection of technology and healthcare. So it covers the evolution of digital health, agile methodologies for personalized interventions, and we discuss the impact of innovation and entrepreneurship on healthcare efficiency. The Research Methods and Ethics course covers research methods in the digital health ecosystem. That includes quantitative and qualitative approaches. It explores ethical considerations and regulatory aspects of health technologies like wearables, apps, and different social media platforms. So the foundational courses will set the stage for our specialized curriculum. For example, students may be inspired with concept ideas in their original courses and the methods for developing these projects. And then this work can be later showcased in a portfolio that can help them to be competitive in the job market. We end with the capstone project, which is our culminating applied experience that's designed to give students real-world exposure that's aligned with their specific career goals in the digital health field. So projects may take the form of an internship with industry or campus partners, perhaps a research lab, healthcare organization. It could also look like a meta-analysis or a review paper, an independent or group-based analysis of an existing data set, or perhaps looking at workflow improvement initiatives or solutions to improve healthcare delivery gaps. So each project will include documentation and then a final presentation to faculty and peers. The capstone projects are flexible and they're tailored specifically to student interests. So for those of you who are already employed, it is possible to complete the capstone project through your current workplace. We just have to approve the project to ensure that it aligns with the goals of the program. So some examples of recent student capstone projects include designing custom digital interfaces to improve communication workflows in a medical office, conducting user experience interviews, and developing a new user interface to enhance the usability of a startup fitness company and their online platform. Another student conducted interviews with patients in communities with low resources to identify their health needs and inform the design of a system for tracking their health records. So these are just a few directions that current students have taken, but the capstone can really be designed to fit your specific career goals and your specific interests. So now back to Kira.
All right, a little bit more now about the online learning experience. First, students can expect to spend about 2 to 3 hours per week for each credit in a course. So for example, a 3-credit course would generally take a student about 6 to 9 hours per week. Next, we use an online learning platform called Canvas, and each course will vary in the types of activities and assessments. All of those things can be found on Canvas. The expectations of those activities and assessments will vary based on the class. In addition, there will also be things like quizzes, applied activities, presentations, and projects, all of which, again, are in Canvas. So next thing, I'm going to pass back to Michelle, and we are ready to hear more about the career potential for a degree in digital health.
Yeah, thank you, Kira. So digital health has real-world applications across various sectors. Examples include enhancing patient care and in operational efficiency in healthcare, developing innovative health technologies, and optimizing medical devices and systems in engineering. Our program equips graduates to be competitive and excel in various areas where health and technology converge. This degree will distinguish students in the following areas: healthcare, IT, and telemedicine. This involves telecare, activity monitoring, and remote medication management roles. Health apps, where you gain experience with development and management of wearables, glucose monitors, activity trackers, and fitness apps. Monitoring services such as solutions for independent aging, chronic disease management, and post-acute care, in addition to health analytics, including opportunities with health insurance companies, software and product engineering, in addition to web application development. A degree in digital health opens up opportunities in a variety of fields, from managing risk and improving health outcomes to advancing drug development and delivery. You could also have the chance to lead data-driven health research, shape impactful health policies, and promote population health and disease prevention. There are a wide variety of applications for which you can use this degree and for which you will be well prepared. The American Medical Association identified key healthcare technology trends for 2025. They highlighted wearables, integration of remote patient monitoring into care models to facilitate chronic disease management, telehealth, tailored messaging, and AI tools that may help reduce documentation workload and support clinical decision-making. They stressed the need for thoughtful implementation of these technologies that considers people, processes, operations, and workflows required to integrate these tools in ways that deliver meaningful value. For 2026, the AMA continues to emphasize that the rapid expansion of augmented intelligence, telehealth, and remote patient monitoring will accelerate, with physician voices remaining essential to ensure these technologies are implemented safely, integrated effectively into clinical workflows, and used to meaningfully reduce administrative and cognitive burden. In parallel, the American Association of Nurse Practitioners anticipates similar trends and further indicates that at-home diagnostics are becoming mainstream components of care, and that AI will increasingly support diagnostics, documentation, and risk assessment to enable more personalized and coordinated care. Decades ago, clinicians managed far fewer structured data elements during an ICU encounter. Today, electronic health records, monitoring devices, lab systems, and imaging generate hundreds to thousands of discrete data points per patient. Our program provides education and training on how to develop tools to collect, aggregate, analyze, visualize, and synthesize this data. These skills will set you up to be competitive in the job market. Along those lines, I will now pass it off to Kristen again to talk more about the career opportunities.
Thanks, Michelle. So the digital health field is rapidly expanding due to a number of factors, such as an aging population, increasing chronic disease rates, and changing consumer expectations. So employment in healthcare occupations is projected to grow with approximately 1.9 million openings annually. Careers in health information technology specifically are expected to grow by 15% over the next 8 years, which is much faster than the average for all other occupations. Two digital health professions are among the U.S. Bureau of Labor Statistics 2024 fastest growing occupations. The first being medical and health services managers, which is projected to grow by 23% by 2034 and has a median pay of more than $117,000 annually. The second being information security analysts, and this field is projected to grow by 29% by 2034 and has a median pay of more than $124,000 annually. So the healthcare and social assistance sectors are expected to drive employment growth in the U.S., accounting for about 38% of all projected job gains between 2024 and 2034. So this employment growth comes from both the aging population continuing to expand and the growing prevalence of chronic conditions such as heart disease, cancers, and diabetes. So our program prepares you to offer accessible, efficient, and personalized patient care, ensuring job security and ongoing learning opportunities in this field. We'd love for you to join us and become a leader in digital health, contributing to innovation in healthcare practices and research. So let's take a look at the return on investment that you could expect by joining us in this field. So the salary range for this field is wide, as post-program pay can vary quite a bit depending on several different factors. Your experience, your geographical location, and any previous education that you have can significantly influence your earning potential. However, that range also indicates that there's plenty of room for growth as you gain more experiences in this field. So in addition to the promising return on your educational investment, your tuition after scholarships alone would stand at $21,300. So that's a sum that could potentially be repaid within.
If you are currently employed, you could possibly reduce your out-of-pocket cost even further. Be sure to visit your company's benefit package to learn if they have any educational reimbursement plans that your company may currently have. I am going to round out the content portion for us. I appreciate Kristen filling us in with all of that information. First, I would like to let students know about my role as a dedicated person in the program to help with, I'm sorry, I lost my spot there when we were taking over. I have provided student support for the program. I am one of your go-to contacts. I will help answer your questions and connect you with any other university services you may need as you navigate through your time in the program. You will be in regular communication with me as a student. Admission to all graduate programs at Iowa State University requires a 4-year degree or equivalent from a regionally accredited institution. Your previous degree does not need to be in a closely related subject area. Academic records or transcripts must be submitted with your application. The graduate college also requires applicants to maintain a minimum grade point average of 3.0, but the program may alter that requirement. Additionally, non-native speakers of English must demonstrate their English proficiency. This program utilizes a rapid admissions process, which means applicants are reviewed and admitted within 7 to 10 days of applying. Most courses are offered in an 8-week sessions format. Students may start the program at multiple entry points, including August, October, January, March, May, or June. When you are ready to apply, you will use the graduate application at iastate.edu. The application fee is $60 for domestic students and $100 for international students. If you decide to apply to the program, the college can waive your application fee. You will want to reach out to me at asflynn@iastate.edu before paying the fee, and I can waive that for you. I want to add here that we have seen some interest from students who are using the program as a gap year before med school. So if you are in that position and considering a gap year, this program would be a great way to boost your application, dive into digital health, and build up some real world experience that will set you apart. Students in any distance education program here at Iowa State University can benefit from the distance education tuition rate no matter where you reside. You are assessed a mandatory technology fee. Students enrolled in a distant education program are not charged other student fees such as the activity fee, the service fee, the health fee, and the health facility fee. Iowa State University offers a deferment option for employees and businesses and organizations that provide tuition and reimbursement programs. If needed, you can register for the employer reimbursement deferment plan to defer payment of your tuition and fees until the end of the semester. Additionally, with this program, we are offering up to $1,800 in scholarships for students who enroll this academic year. We can get you information about any of this if you reach out to our student services team. Finally, Iowa State University offers many academic, career, and well-being resources to support our students, from the Center for Communication Excellence to mental health resources like telecounseling and well-being coaching. We are committed to supporting your success in every aspect of your university experience at Iowa State, and we would be happy to connect you with any of these resources once you are a student.